Welcome back to Season 6 of Inside Medical Malpractice. I'm Chris Rokosh, your podcast host, and I am so happy to be back with you. It's been a while since I recorded an episode, so it's good to be back in the saddle, so to speak. I was looking at some stats a couple of days ago on the podcast, and it turns out that this is the 75th episode, and we've had over 85,000 downloads. And so I just first of all want to thank each and every one of you for listening in today. I appreciate it so much, and it honestly is the thing that keeps me going. Today on Inside Medical Malpractice, I'm joined by lawyer Jan Marin, who's been writing and speaking about how AI is transforming clinical decision-making in healthcare and reshaping malpractice law in the process. A few weeks ago, I came across the first of two articles that Jan had published in Canadian Lawyer magazine. And the first one, which we're going to discuss today, was titled AI, Accountability and Medical Malpractice. And when I read through the article and kind of looked at the summary, what came out of it for me is one of the most fascinating and urgent questions in healthcare today, which is what happens when AI gets it wrong? How is that going to play out in the courts? This question and that entire article caught my attention. So I got in touch with Jan, and she so graciously appeared to be a guest on the podcast, both today and for a second episode to discuss the second article, which I'll talk to you about before we go. Welcome, Jan. I want to thank you so much for being here.
Thanks, Chris. Happy to be here.
Great. Let me first tell you just a little bit about Jan before we get started. She's a senior lawyer with Gluckstein Personal Injury Lawyers, where she specializes in medical negligence. She has over a decade of experience advocating for patients and families, and she brings deep insight into how the standard of care is applied, how it's challenged, and how it's ever evolving in the Canadian courts. I would say, is a thought leader. She might be a little bit humble about this, but to me, a thought leader on emergency technology in healthcare, and particularly focus on how AI is transforming clinical decision-making and in the legal consequences that will follow. She's been featured in publications and speaks on the future of patient safety and legal accountability in the age of AI. For me, I just happen to think she's brilliant to get ahead of game of this, and I know none of us probably feel as ahead of AI or as knowledgeable about AI as we wish we would, but I think many of us feel just a little bit dumbfounded by a fast-moving train, and we're just hoping that we catch it, or we're scared of it, or we don't trust it. There's a lot of feelings out there about AI. So I appreciate a conversation about the realities of what's coming and the preparation, perhaps, or what the things we need to be ready for and start to prepare for. So stay tuned and listen up, because whether you're a lawyer, a healthcare provider, a patient advocate, or simply curious about the future of medicine in AI and the inevitable accountability, this is a conversation you're not going to want to miss. So Jan, thank you again for being here. Are you ready for some questions?
I'm ready. Throw them at me.
Okay, here you go. I'm interested just on a personal level, and I think everyone else is too. What drew you to this intersection of law, technology, and healthcare? And second part of that question is, what are you most curious to watch unfold?
As you said, Chris, this is a fast-moving train, and we all are going to need to get on it, whether we want to or not. There's a lot of trepidation in society, really, not just in medicine or law, about what AI means, the dangers of it. I think it's actually pretty exciting, and some of the AI tools we've started to use both within our firm, but that I've also seen starting to be implemented in healthcare settings, and even in my own cases. I've had ideas where I've said to some of my experts, I have an idea of an AI tool that could have prevented this error. So I do think it's really exciting. I also think that we're all going to be well served by wrapping our minds around some of these things before we're in the middle of a case. One of the things I love about medical negligence generally is the constant opportunity for learning and exploring and investigating and figuring out what happened. It's one of my favorite things about this area of law. And so I just, by nature, I'm a curious person. And that sort of led to my thinking about this. I don't have a tech background. And so it's really just been a learning by reading and doing and talking to people who know more than I do. In terms of what I'm most curious to see unfold is I really think that there's a lot of exciting opportunities in healthcare. I think it is going to make a big difference. Generally, I think it's going to be a positive change for patients and for healthcare providers. It's going to prevent burnout. It's going to prevent errors. And I think all of those things are really good things.
They are good things. I mean, the easy access to information over my career as a nurse, which is a long one, 40 plus years. I just can't even. I pulled out an old textbook a couple of weeks ago because I'm trying to talk my 3 grandsons into all becoming doctors. So I pulled out this old book that called The Compendium of Pharmaceutical Supplies from about 1995. And I was like, read this. Like, first of all, learn the title of it and read it. And they're like, we don't ever need to read a book to figure that stuff out, Grandma. Like, I know things have changed so much, but I'm with you. I think it's a very exciting thing to watch, but it doesn't come without, its risks and its problems and its learning curve and its growth curve. There's so much changing every day. But what do you feel at this time? What's the most exciting or the most unsettling aspect of the integration into frontline healthcare?
Exciting is easy. I really think that it is going to assist with diagnostic care. I really think that there's going to be opportunities for, inpatient care where there's an AI monitoring a chart to see subtle differences in vitals over time. And, particularly in acute care floors, we've got tons of patients. I think it's going to identify things. I also think taking away some of the charting out of the hands of the healthcare providers to be done automatically is going to be huge, and they're going to love that. Unsettling. I do worry about healthcare providers becoming a bit too laissez-faire with it. So relying upon it too heavily and their own clinical judgment and skills dulling because you become reliant upon these tools. That is the most unsettling part for me. And as we are going to chat about, I'm sure there are opportunities where AI is going to get it wrong. And I think that doing this in the right way and maintaining clinical skills alongside the AI is critical.
Do you have any advice on how that can happen? I mean, I guess it's happened in many, like, for instance, like, we all have GPSs now and none of us could read a map anymore, or I can't find my way around anywhere. And it's definitely a skill that I've lost, but it isn't necessarily a skill that I need anymore. And not that that's, directly comparable to healthcare, but because there's so much that's eyes on, hands on, and intuition even, and sense, and then looking at the clinical data on top of that. Any suggestions for how those two skill sets are maintained?
That's really interesting. And thinking about, GPS, because I too blindly rely upon a GPS a lot of the time. I would compare it though to, ChatGPT. I use ChatGPT all the time. I'll get a new client call who's telling me about a medication they say had an interaction with something else they were on. And I'll pop it into ChatGPT to get a quick and easy answer. But I don't rely upon that blindly. So I will then go to the secondary sources. And I would say 80% of the time it gets it right. 20% of the time it doesn't. There's something in there that's completely off the wall, not quite as clear as it seemed to say that was. So, I do worry about that quite a bit because I think that there is that opportunity to happen, that, these tools get in place and there is an over-reliance upon them. And I think it's inevitable. And I suppose I go back to, I'm not prone to worrying usually, and I try to be very practical about things. And so if we look at AI and think it's going to catch 50% more of this rare condition, there may be 4 or 5 cases a year that are going to slip through the cracks. Well, we're still catching more things than we did before. So holistically, is it a benefit overall? Probably, yeah. That's the end result. But then those that fall through the cracks, there's going to be questions, and hopefully these tools get better. with the comparator of GPS, for example, we all know now that because we've seen it play out, how reliable GPS is. And I think the same will prove true with tools. And there's going to be some that don't, in the same way pharmaceuticals over time. Been some big oopses in terms of, okay, this medication wasn't really what we thought it was and caused a lot of problems. Historically, that we learn by doing, by example, and I don't think that this is any different. And I think we just need to be alive to all of this. It's not something that we're going to always have the answers for, and that every clinician is going to remain on high alert for these errors. Of course not. But I remain hopeful that overall it's going to be a benefit to the future of medicine.
Yeah, that's a great answer. And I like the analogies that you gave to other technologies that have taken, and drugs and pharmaceuticals that have taken time to get sorted out. And, that growth period is difficult for sure. But, it's probably just a reality of how things are going to go. And certainly even sometimes now with GPS and, some other technologies, it's telling me to turn. I can see that the place I want to go is right over here on my left. And it's telling me to turn right and do a U-turn. And I'm like, you still have to have that common sense. And I think, in all things, in even older technologies that are used in healthcare, there has to be a healthy, not distrust isn't the right word, but skepticism about the information and the data that you get, because you have to look at the whole picture, the whole clinical picture. And I heard a couple of days ago, I was listening to a podcast on AI, and they talked about one of the skills that we have to pick up now is not just believing what we're reading, because that's just too easy, and it is sometimes wrong. There are errors, as you know, but we have to become good researchers of research. Even we have to get skilled at interpreting research so that we understand the information that's being spit out by all kinds of things, in the media, but certainly in AI.
Critical thinking, right?
Critical thinking and curiosity. Yeah, great. I love that you said curiosity, because I think, neither of us admittedly are skilled at this now, but we're curious. And that's what's going to get us, across the finish line, or at least get us, moving in the right direction. So that's really good. I was really interested in the article that you wrote about all the different AI tools that are currently being used in healthcare right now. Can you talk to us about those, what they're designed to do and how they're currently being used?
Yeah, absolutely. So I put them into two different categories. So there are administrative tools, and then there's tools that I would say are more directly applying healthcare, being involved in healthcare. So right now, there's a lot of opportunity for EMRs, or electronic medical records, to use AI tools administratively. So that might be for transcriptions. Instead of, the doctor calling in their surgical note down to the transcriptionists who are going to actually type it up. This is going to be automatic. It already is. That dragon dictation, very commonly used in hospitals all the time. But also documentation. So there can be, for example, the history section of a consult note might be automatically populated with information that's in the chart. The physician can review it, might supplement, but a lot of it's already there. They don't need to take the time to go through all of that again. Note taking, referral letters, evidence searches sometimes, or even I talked before about medication interactions. Doctors can use AI tools to give them a lot of that information, particularly when they're medications that a patient might be on for a completely different condition that's not familiar to that doc. They still need to know about all of that. And all of that becomes so much easier with AI tools that are being used. There's also patient intake processes that use AI tools. Patient engagement too. So post-surgically, auto follow-ups that are being done by AI tools, patient messages, reminders, forms for them to fill out, referrals, prescription renewals, orders, all of these things can be done with the assistance of AI and then approved by a doc. That will really improve workflow, will really improve the amount of time that healthcare providers are spending on administrative tasks and not providing care directly to patients. So I think, and I generally don't have nearly as much worry about any of that. I think that that's just really cool and is going to make a big difference to healthcare providers. The other side, the medical care side that I mentioned. So AI is being used in drug development. We're seeing major advances there where AI is actually able to assist. And this can be from vaccines to different uses for medications, how the pathophysiological impact of a medication might actually work for a condition never thought of to be used for that medication. So AI is being used in that way for drug development. There's also AI programs being used for mapping and tracking infectious diseases. They do forecasting, modeling, projections. And then there's the actual usage of things that are happening to assist with radiology, for example, interpreting imaging and having being able to detect fractures or being used in CT, MRI. These things, some of that is on the newer side, but certainly that's being used. There's also apps. So I would say, this is it's not directly in healthcare being used by doctors, but there might be apps, for example, that, and we'll talk a little later about how these things can go wrong, but mole identification. Is this a likely benign or a potential malignancy? And how does that work? And things of that nature. What I hope to see, this is getting a little bit ahead of the question, but I'm really excited to see, we've seen a lot of hospitals put in place sepsis early warning systems. And I think that's great. And there's protocols that if any two of the following abnormalities are present, you need to work the person up for sepsis. And it's going to catch a lot of people that it doesn't apply to, but you're going to catch those that otherwise would fall through the cracks. There's so many opportunities for these kind of things in hospital charts. And this is, I mentioned earlier about in my own cases, having said to my experts, if only this existed, catching, signs of peripheral arterial disease and a potentially developing ischemic limb and looking at, now we have, pain changes, temperature changes, pulse differentials that the AI could pick up. Because I have those cases where retrospectively, it's very clear, but no one saw it. And I really think AI can be a supplemental review. So not replacing nurses or doctors or anyone else, but having it in the background of these medical charts and just having little alerts pop up for the healthcare providers. Have you considered X, Y, or Z? And I'm really excited about that because I think patient safety is going to improve dramatically once those kinds of tools get integrated with medical charts.
I'm fascinated that you, I've seen recent cases by both of those things that you talked about, the ischemic limb and sepsis, an undiagnosed sepsis. And it was really fascinating how, in this particular case, it was a healthcare provider. The patient had no palpable blood pressure or pulse, but she was talking. And so somehow the talking took precedence and reassured the healthcare provider over the lack of a blood pressure and pulse. And, of course, over time, a very short period of time, we had a full-blown cardiac arrest and a crash. But I mean, that was very striking to me, because there's other people working on sepsis. I had Dr. Michael Wong on the show, or not Dr. Lawyer, defense lawyer Michael Wong on the show, and he's working on worldwide recognition of sepsis. And I didn't always kind of get that it was as critical as it is, but you're absolutely right. There's so many cases that are missed when in retrospect, you're like, there it is. There it was for 2 hours or 3 hours before this, absolutely decompensation happened. So I think that's really exciting too, because we can sometimes as healthcare providers be reassured by the wrong thing, ignore a terrible, a very worrisome clinical finding. One of the patients talking or walking or kind of looks okay. You're like, they're fine.
Yeah. And, in a lot of my cases, I always have a lot of sympathy for healthcare providers, maybe more than the average plaintiff lawyer does. And that doesn't mean I don't think my cases are meritorious and that I'm going to bring them forward because the patient deserves to be compensated when an error has occurred. But as a professional myself, one who's not infallible and has made mistakes, I know it can happen. And, when I look at these cases, most often I don't think to myself, this is a poor healthcare provider or someone who's not good at their job. I think, oh, they missed something. It was there to be seen. And there might be many different reasons, including just simply being focused elsewhere. So my peripheral artery disease case that led to an amputation, they were worried about other things. There was GI bleeding going on. There were breathing issues. There's all kinds of things happening with this patient. So the issues with her lower extremity just were not the focus. And while I still believe firmly that I have a very strong case, I also think, these tools would be so helpful because I can just see the healthcare provider in retrospect being like, oh my God, I really missed this. And, it was because my attention was elsewhere. And I see that a lot. And I think that this is really poised to help both healthcare providers do their job better, but protect patients as well. And I think all of those are laudable roles for the technology.
I agree. And I think there are roles that we should every single person on the planet that has access to these tools should be grateful for it, not scared of, use wisely, use cautiously, use with a little bit of skepticism and research, but, a big boon, and just a plus, anything that helps with proper diagnosis and treatment. So I don't know if any cases have happened yet where AI is involved in a patient harm outcome, but when and if it does, how will you as a plaintiff's malpractice lawyer even begin to assess liability? And what do you see as the biggest legal challenges in that?
Oh, loaded question. I think there's layers here. So I think at the most basic level, I think lawyers are going to have to do a lot of learning. These things aren't going to come easy. We're not going to know right away where the error occurred or why. It may involve more digging, different kinds of evidence, different kinds of experts, different kinds of tools to explore where all this happened. One of my real concerns is, and I think we'll get into this a little more as we talk through all of these issues, is that a lot of this is going to come down to the training of these tools. What data sets are they provided in the background? And that information is not publicly available. It may be proprietary, so it may not be easily accessible either. And how do we deal with that? And how do we understand it? I've received metadata in many of my cases. And even that, you can kind of wrap your mind around a lot of it as you get into it, but it's complicated. AI data is, many times more complicated than that. And I'm not sure that a lot of people, even in the software, traditional IT space, fully understand AI. So how then are lawyers and judges supposed to understand it? And healthcare providers, your focuses are elsewhere. So to understand and know what is happening and where the errors could be and are they there? And I also, from a legal perspective, a plaintiff lawyer perspective, I wonder if we're going to have problems with proof sometimes. So is an AI's failure to catch something going to bolster a defense that the standard of care was met? Because, well, if this tool couldn't pick up this condition, how could a human be expected to pick it up? That might be true. It might not be, because I can give you a number of examples of where the tool may not be as good as a human, particularly for very nuanced, very subtle changes. If the tool is trained on a population of Caucasian people and you have a darker skinned patient who, like going back to the dermatology cases, the tool might not pick that up. ECG interpretation. If there's background noise or other technology that is impacting the tool and the tool was trained on clean reads, it's not going to know all that a human would. So there's all these layers and nuances that I really think are complicated. I worry a little bit about the bolstering of the standard of care when we aren't going to know for sure how the tool was trained. That does worry me a little bit, and trying to figure out all of that. And so, how do we do this now? There's lots of cases where, medical malpractice is a really intense learning curve, but the more you do it, the more you understand. So now, I can read a fetal heart tracing. I know what normal vital signs are. I can look at a chart and have a pretty good sense. I know how to read lab results, all of these things over time. I'm hopeful that the more information we gain in AI, it'll be the same. However, it is more difficult. This is more nuanced. It's more technical, and it's going to be a challenge. There's no question about it. And so I think that it's a process ultimately. And I, truthfully, Chris, I went so far afield. I'm not sure if I answered your question.
No, you did. It's like how the question was, how will you even begin to assess liability? And you talked a lot about what you're going to have to know to even look at the liability issues. But the second half of that question is, what do you see as the biggest legal challenge? Like, just for me, I'm thinking, and we'll talk about this more in the next episode where you talk about, the use of AI in malpractice more specifically, not so much in the hospital setting, diagnostic errors and things. But I can't imagine, like, you know, who all you're going to sue or who you might find potentially liable and how you pull all those people in. And maybe I'll hang on to that question because I think we're going to talk about that in the next episode. But to me, I see that as a huge legal challenge. Like, who are the defendants and what are they individually liable for? And who represents them? I kind of think of COVID, it's interesting. As you know, I have a medical legal expert witness, and we're seeing some COVID cases have been popping up and coming through our company the last couple of years. And there's so much of it where the healthcare defendants are saying this, our knowledge and the recommendations changed every single day. Like, we were never sure of who we should listen to and what we should be doing. And I don't know how that's going to play out as a defense, but my heart feels for that because I feel, just as I wasn't clinically active at that time during COVID, but just as a person and a healthcare provider and a nurse and trying to keep your family safe, I just felt that was such a real challenge. And who do you listen to and who's liable when things go wrong? Because everybody's doing kind of the best they can with what they have at the time. I don't know if you see any simile between that situation and this.
Yeah, it's very interesting because, I did a couple interviews about COVID and how I thought it would impact medical legal cases and, things like family members not being able to accompany family member to the ER, for example. So you lose all that collateral information. And the advocates as well to say, hey, no one's seeing my family member. And that's concerning, or all the virtual visits. So physical assessments are lost. And the checks and balances that need to come into play with that. Because I agree with you, like all of those things were for everyone's safety and are good things. And goes back to critical thinking, right? So which patients really need the physical assessment? I know I was grateful as a patient when I could just, especially with my kids, when they would get sick, I could just call up our pediatrician and have that. I was so grateful for not having to drive across the city for that. But to know when there are times where, okay, this person really needs to be assessed physically. I think that the same goes high level going back to basics and general principles comes into the world of AI as well. And so what things can we rely upon it for? And what things do we need to have a little bit more of a question mark on? And again, this is, if I can put it this way, a living process. It's evolving and changing. And I don't pretend to have a simple answer for this. And it's fact specific, technology specific, patient specific. Like all of these things are important, and maintaining that critical thinking about what you're using and how you're using it is important. You cannot just blindly rely upon any tool or to your own detriment. It should be a check and balance on the system. It shouldn't be something that entirely replaces human interaction. I've heard medicine described as both a science and an art. And so the science side is very well suited to use AI. There may even be a time when laparoscopic surgeries or robotic surgeries are fully performed by AI. And there's benefit there. You are never going to get an overtired surgeon. You're never going to get someone who has a slight slip I hate to say this, but I've had cases where I'm pretty sure the surgeons involved in their late 70s probably shouldn't have been performing surgery anymore. Well, you're never going to have those kinds of things when using AI, right? However, On the other hand, there's also going to be times where there's more of an art involved. And diagnostically, that's going to be important. Subtleties are caught by the art of medicine, not the science of it. The rare diagnoses are caught by the art, I would say, not the science. And, I'm sure we've both seen that all the time where clinicians assume the most common diagnosis. That makes sense. 999 times out of 1,000, the person with back pain just has back pain. But if you miss the spinal epidural abscess that one time and the person has a history of skin infections and you didn't think about it, well, you might get sued. You have to rule it out when you've got a warning sign. So I think that those basic principles are going to apply both for healthcare providers in the implementation and reliance upon it, but then also in the assessment of medical legal cases.
Yeah. So I kind of get a sense that this is all brand new, but kind of not new at all. I mean, in some cases, we've introduced new technology and many different levels and many different ways in the past, but maybe just not to this point where it really affects clinical decision making quite to the extent that AI has the potential to. So, as you said, interesting to play out, and the art and the science, and the man and the machine is always what's going to be all about. Could you walk us through, or could you come up with a hypothetical case where AI failed to detect some condition, and who are the people that might be named in that lawsuit?
So I thought about this, and I've got a couple examples that we can talk about. So one would be the radiology cases. So assume that radiology is assessing a chest X-ray. Looking for early signs of lung cancer. And the AI sees a faint opacity and interprets it as an artifact, for example. The scan's reported as normal. But maybe this error ends up occurring because the program was not trained with enough data related to smaller atypical tumors. There might be motion blur. Is the AI able to detect that? Does it confuse the algorithm? If a clinician over relies upon that AI output, rubber stamps it, moves on, you're going to have a problem. I've talked a couple times about dermatology and a dermatology app potentially failing to flag melanoma, for example. With apps, there are already apps out there that train to identify skin lesions. So you take a picture, upload it to your app, and it can give you a question mark, see your dermatologist, or most likely benign. But if the AI is trained on lighter skin tones, it may lead to worse accuracy with darker skin tones. How will we know that? What happens there? That's a problem. There's also, and I mentioned potentially ECG misinterpretation because of background noise. That could be a problem. And then I also think about, I do a lot of obstetrical cases. And so if we have an AI monitoring system for the fetal heart rate patterns, but the algorithm's not sensitive enough to certain signals, or do we have artifact happening and it's or is it misinterpreting maternal heart for fetal heart? We see that all the time, and sometimes it's subtle. It's not always perfectly clear, and it goes back to the training of these programs. And I can see in each of these examples a hypothetical error occurring, and it's mixed, whether this is going to be AI tool error or clinician over reliance. I really think, and I've seen this already actually, and it's not AI specifically, and we may talk a little bit about other kinds of cases where technology has led to errors, but one of the types of obstetrical cases we've seen is labor and delivery nurses waiting for the alarms to sound on, there's programs like OBIX, which are great and give you lots of interpretation and actually will do some interpretation of the fetal heart. But if the alarm's been silenced, or if there's an oversensitivity and nurses are used to just silencing it because this is nothing, it's nothing, it's nothing, and it then isn't used in the best way possible, these are issues. I mean, those kind of cases are beautiful for plaintiffs' lawyers, because when you see all these alarms silenced, it's fodder for cross-examination. But these are ways that the reliance on these systems potentially can cause concern. And I see all of these things as having the door. And I'm sure there's many, many examples of things I haven't even thought about how this can happen. I mean, half of my cases, oh my gosh, I can't imagine how this could occur. And here we are. So, it's going to evolve over time for sure, as the tools do and as the case examples come out to alert clinicians, and hopefully people communicate about it. That ultimately, before we started recording, I was telling you about my fertility practice. One of my big beefs in the fertility world is that there's no mandatory error reporting. I really hope with this technology, we can learn from others, because otherwise it's going to be fraught with problems. But if we can see at one institution, internationally, anywhere, that this is an over-reliance or this is a problem, others can learn from it. And I'm hopeful that there will be some mechanism for that kind of reporting to happen. In the absence of that, or some kind of assurance that the programs and developers themselves will learn from the errors, it could be a long road in learning.
I think it's interesting that you brought that up, because I think reporting of errors is a much broader problem than just infertility. And I could certainly see that being a huge issue all across the board with this kind of hybrid healthcare that will be delivered. What do you report and who do you report to? And then, of course, the big question, who and where do you investigate to even track down the source of the problem or the root cause of the problem, whatever you want to call it. Yeah, so that's going to be interesting to play out. And we're going to talk a little bit more about that in the next episode. So what do you think about healthcare providers right now, physicians in particular, but everybody who's using or relying on AI? Should they be concerned or being skinny it up on the legal risks of relying too much or too little on AI?
I would never, I don't know if my colleagues and friends at the CMPA or the lawyers that represent docs through the CMPA would agree with this. I'm not sure. But I am always concerned when healthcare providers put legal risk before healthcare. There's insurance, there's lawyers to take care of you. And there are going to be times when you just need to make difficult decisions and not be thinking about the legal risk. And I don't know really how else you could practice medicine. There's the basic stuff you can do in terms of clinical note taking that will protect you. But when it comes to decision making around healthcare provision, don't think it should ever be based upon limiting claims, because I actually think that can be problematic for many, many reasons in and of itself. And so when it comes to using these tools, I think they should be evaluated on the basis of, is this going to improve care? Is this going to improve physician work-life balance and stress and burnout? Are these things that can be replaced with very little risk to patients and big benefit to healthcare providers? And then secondly, physicians need to do what they're trained to do and use their critical thinking, use their education, use their experience to assess whether these tools make sense. And, I think, at least for me, when I'm using these, not healthcare tools, obviously, but when I'm using legal AI tools, I'm very reticent in the beginning, and I will check against those tools. So, for example, we sometimes in the office will use AI to do certain medical record summaries. Well, when it comes to critical records, like liability records in my case, I don't use them. I do it myself because it's too important. When it comes to, a GP record that's just assessing the impact, for example, of damage, I'll try it. And then I go back and I do the one-on-one assessment. Did it get it right? And that will then give you comfort or not that it's getting it right or not. And I do think doing those kinds of double checks are critically important when you're relying upon a new tool. To blindly think, oh, this is great. All my, the radiologist who says, oh, AI is interpreting these for me. Perfect. I sign the reports, off they go. Now I've saved half the time. I still get to bill for, the 20 reports I looked at today. Well, that's a huge problem. And if it turns out that tool is making repetitive, similar errors, you are in trouble. So do what you should do, which is, for the first while you're relying upon these tools, check it, and use them for things that I talked about before, the administrative tasks. that aren't going to be so fraught with the potential of misinterpretation. And so I think doctors should be excited about these tools. I think they should absolutely be trying them, with the caveat that, to your own detriment if you blindly rely upon them without doing your own check.
That's really good advice. And I think the trial and error, and I think that's the biggest thing, is to not trust it, but not fully trust it, but to try it out. Because I see that a lot of people who will just say, I read, and a lot of people will read just the headline of the news and say, and this is truth. And then they present it as fact. And I've always been snoopy enough to get right down into it and say, wait a sec. That's a big over exaggeration of what's going on. So that's really good. But I would imagine too, is it, I think I like how you had the analogy of using the legal tools. And I think we all have that in personal life too, where we're trying to use ChatGPT, whether it's for emails or to review a document or to summarize something that you've written or just make it cleaner and better. I recently went through 2 weddings where I was the maid of honor, both of them. And I wrote my speech and then I rewrote my speech in AI and it was so much better. But I still had to go through it in great detail and make sure the facts were right. They didn't get the bride's name wrong.
Yeah, and that goes back to those administrative tools, right? Like write your consult with AI. It saves you half the time, but go back and read it. Make sure it's right.
Exactly. You have to. So bottom line there, you're saying physicians should give this a try. Start with the administrative tools. Don't blindly accept the information that you're getting from any diagnostic or treatment tools, and just work with the evolving nature of what's happening. Is that a fair summary of what you had to say? Yeah. Okay. That's really just generally very, very good advice. From your perspective, I'm going to ask you a couple of, let's start with this question. Give me an example of how complex technology has shaped or altered past legal verdicts.
There's a few examples. So I talked a little bit about, some of the over-reliance upon alarms and things like that. Another example of that is often neurosurgery relies upon intraoperative neurophysiological monitoring, or INM. And this is real-time central nervous system monitoring during surgeries with the goal of preventing injury, usually nerve injuries. But there have been claims that are arisen from this technology, both from a failure to use it. So I personally had a claim, it was a complex spinal surgery, that my expert said there's no reason this should have been done in the absence of the neuromuscular monitoring. It just doesn't make any sense because it's such a clear tool. So that's like a basic non-reliance upon something that can prevent injury. But then there's also claims that have arisen because there's a failure to interpret or an over-reliance upon it and not using critical thinking. I've had a couple cases where there's been alarms disengaged or silenced and the team providing the care doesn't know that. So I actually had a case where it was a heart-lung bypass machine being used and the perfusionist, and I didn't know what a perfusionist was originally when I started this case. That was a new area of medical professional that I didn't realize existed. But the perfusionist in this case, a very experienced guy, went in to do his job that day and I think ultimately was a little distracted, but knows that the machine does so much of his work for him. But what he didn't know is that earlier in that day, there'd been students in and been training on the machine. All of his settings, which are there 99.9% of the time, because it's his machine, he's really the only one who uses it at this institution, had been changed for training purposes. And this goes, there's been a lot of studies done around the analogies between airline protocols and pilots and all of the checklists that they have to do and comparing that to how surgery should be performed and these checklists being done. And most of the time, these types of checklists are going to be second nature. Everything's going to be perfect. But the reason you got to do the checklist is the check and the balance to ensure that that one tiny little setting change, we catch it. And I think that comes into this. And that's another example that case, it led to a profound anoxic brain injury because the blood wasn't being oxygenated by the machine. No one knew it for 7 or 8 minutes. And it's all because the settings on the machine have been changed. And had there been this kind of checklist in place, that check and the balance. So I think that with technology, and I've said this in a couple different ways, but over reliance can be its own problem. And you cannot become too comfortable with these changes, and then ultimately you're going to miss things. So it's still putting in place these basic procedures to ensure that everything's being done properly. And you can envision input data that the hospital has to input to a machine where, I don't know, the age of the patient, the body mass, the vitals, all of these things. If there are inaccuracies there or basic settings that are altered for training purposes, for example, and then the technology is used on its regular basis, the output is going to be completely different. And so, I think ultimately these kinds of cases are illustrative for the purposes of saying, over reliance, blindly relying upon technology can cause problems.
That's a really great example. The other thing we talked about just before we started recording is this isn't meant to be gloom and doom. And I feel, I hope everyone feels some level of reassurance that the introduction of this new technology into healthcare is not the first rodeo for any of us, right? We've had so many changes in healthcare in the last, well, if you can't even imagine what's happened in the last 100 years, but certainly the last 30 or 40 years even. I mean, even fetal monitoring just kind of came in the late 70s and 80s. It's not that old of a technology, and now it's just standard of care, for so many situations. So I hope everyone listening doesn't find this frightening as much as reassuring that we'll get through this. We'll figure it out, but it's going to take all of us. It's going to take what Jan has mentioned several times, critical thinking, not over reliance or a complete mistrust, because I've seen a lot of cases like that too, where the machine is telling somebody something and someone's ignoring it because they're like, I don't believe it. I don't trust it. I don't see it. So, so it's reassuring to me to think we've been here and we're going to get through it. There might be some missteps and some false starts, and certainly a lot of learning and changing that's going to go on. But, it's exciting, and it's hopefully going to be better at the end of this.
Yeah, I really, as a patient, not as a lawyer, but as a patient, I think it's going to be largely a really good thing. And if I were a healthcare provider, I think there's such great opportunities here because there's no question. I mean, you're a nurse, Chris, like some of the charting it's tedious. It can get in the way of patient care. Like enough times I've had a nurse tell me at an examination for discovery when I asked, you didn't chart any blood oxygen sats for 6 hours. Why not? You understood that was important. Yes, of course. I was prioritizing patient care. And I always find that response interesting because it's hard to criticize that on the one hand. But it's still critically important for so many reasons, including other healthcare providers knowing what's happening, tracking changes, knowing that it was actually done. That's more on the legal side. But healthcare providers will say that not infrequently. I was providing medical care. And so, if this is done automatically, if there are vital sign machines that automatically chart it all for you, it's all in the chart. Amazing. That's great. It's done. It's in the chart. We're all going to be happy for that, healthcare providers and the lawyers, because we love information.
Yes, you do. I happen to know that about you. From your perspective, what's one step, do you think, right now that healthcare systems could take to protect both patients and providers as AI moves into the forefront?
I think it is important that healthcare systems be open to these tools. I think they're coming. I do think, when I think of like some rural hospitals or some potentially GP offices not using certain tools, I think it is to their detriment. And if certain tools become standard, you are going to have problems, especially if failure to use them there's errors that could have been prevented. But I think ultimately being open and learning is important for everyone, including the systems themselves and the administrators who are in charge of making these important decisions.
Yeah, that's a great answer. And it may have just kind of answered part of the next question, which was, I ask every podcast podcast guest this at the end of an episode. And I'm going to make it really specific for you because of the topic area, but what's the most important thing that you would like lawyers, healthcare providers, and the public to know about patient safety as it relates to the growing use of AI? And let's take that one at a time. Let's start with lawyers. What's the most important thing you'd like lawyers to know about patient safety as it relates to the growing use of AI in healthcare?
I think lawyers need to remain fluid and open and curious and learn. I think a lot of us doing this work, that's innately who we are and why we like to do this work. Um, in terms of patient safety specifically, I think that it's going to go both ways. There's going to be cases prevented, many of them by use of these tools, and then there's going to be others which are influenced. And I think when you look at a chart, when you talk to a patient, being alive to these possibilities and open to learning is critical, because otherwise you might miss a case that is clearly amiss if you don't know enough about tools that are being used.
That's a really great answer. And I think it probably puts a lot of patients at some kind of peace, because I would want to know if I had a medical malpractice issue today or 2 years from now, that the lawyer I retained, if that was the choice, was savvy to all of this, knew how to look down every single dark corner and assess liability. And then, of course, move forward from there.
Yeah, and I've seen that at play also even in, the obstetrical cases. I'm really fortunate to work with Richard Halpern, who I know you know very well. And it's not infrequent that Richard and I will review a case and it's been reviewed by multiple lawyers before us, and he'll see something that no one else saw. And, our clients are so much better off because of that, and that real innate knowledge and the detailed review. You cannot practice at a high level in medical malpractice and not be willing to really look at every single piece of data that you can find in that chart, because sometimes these things are very nuanced, they're very subtle. And I think that that is a skill set that sets apart the truly incredible lawyers from others. I really do.
That's true. I am always so in awe of how much you malpractice lawyers know about healthcare. I've learned from you every single day, and that's the truth. So answer that same question for healthcare providers. What is the most important thing you'd like healthcare providers to know about patient safety as it relates to the growing use of AI in healthcare?
At risk of repeating some of the things I've said, I really think that we need to figure out a way for clinical skill sets to remain sharp. Um, I think being open to these tools is going to improve patient safety, as I've said a few times, and improving healthcare provider burnout improves patient safety, because you've got people that are able and more resilient and more energy and focus and all of those things, and that increases patient safety. So that's a really great thing. I don't want them to be afraid of change. I think that that's a common in professionals generally. They can be afraid of change, afraid of being replaced. I don't think that that's going to happen. But we really need to, again, it's the same messaging that throughout this entire your podcast that I've been explaining, which is that, we really need to be open to it, but also retain the clinical skills and critical thinking necessary. And to know with AI in particular, not just technology, but it's the information that's input in which dictates how well that AI tool is going to do. So understanding some of that is going to be important. And this, your systems question, healthcare systems, this is where administrators in hospitals may have to hire more technology savvy individuals who can assess deeply the inputs, because garbage in, garbage out is a common phrase for AI. So if it's not trained well, it's not going to have good outputs. And so, all of these layers are important for healthcare providers. Be open, retain critical thinking, and, we've talked about it before, do your checks and balances on the system to make sure it's being used in a safe way.
I think your repetition of that message throughout this podcast is incredibly valuable, and not just hearing those words over and over, but the way you've delivered it. has been, inspires me to be open and curious. So thank you for that. I don't feel at all bad about that. I think the repetition, it's what we all need to hear right now. It's literally what we all need to hear right now. Answer that question one more time for the public. What's the most important thing you'd like the public to know? Because this is something we haven't touched on too much about patient safety as it relates to the growing use of AI in healthcare.
I think it's been great for the public. If you look at, I can remember when I was a teenager and I got my first cell phone, and it was a car phone. And I didn't want to give anyone my number because I thought, I don't want people to be able to get me wherever I am. It's nice to, to not be able to have someone reach you anywhere you are. That was my thought. How far have we come from that? And that's technology, right? Getting comfortable with computers, the internet, for goodness sakes. That is something that people were very uncomfortable with when the internet first popped up. So for the public, I think it's going to benefit us all dramatically having more access to healthcare providers. We have access to far more information, education, and, there's so many more electronic charts for people now that they could go in. They may be able with these tools to put in questions that ultimately can either be answered by an AI review of the chart or routed to the appropriate person. I think by and large, patients are going to be benefited by this far more than it has any scary potential repercussions.
That is a great answer and a very positive answer. I love leaving this podcast hopeful and looking forward and not gloom and doom because, we all know, there's so much about medical malpractice realm that's just difficult, really difficult. So it's nice to have something positive on the horizon. Well, that's all the questions I have today for this episode, Jan. Are you willing to come back and do this one more time based on your second article? I'd love to have further conversation with you.
Of course I am, Chris. It's been a pleasure.
It has been a pleasure. It's been I've learned so much. I again am heartened by the positivity that you're bringing to it, by the future looking for this incredibly important and fast moving topic. And I think as it becomes more embedded in how diseases are diagnosed and treated and patients are cared for, the perspective on how the legal system, and you in particular at this moment, because you're the only person I've ever talked to about this, is both eye-opening and essential. And as I said at the beginning, whether you're a healthcare provider, a lawyer, a patient, an advocate, now's the time to start paying attention to the role of AI in medical decision making. Not be too distrustful of it, not be too scared of it, not just stand by and watch it with confusion and there's a train coming, because the implications are already taking shape. And I firmly believe that we all, every single one of us, has a role in ensuring patient safety and healthcare system accountability. We all have that job. Up next in part 2, we're going to talk to Jan about how AI tools are altering litigation strategy for plaintiff medical malpractice lawyers, another fascinating episode, and how things are changing from discovery to expert evidence, and why eventually hospitals and health systems may become the focal point of institutional liability. Thank you again, Jan. It's been an absolute pleasure talking to you and look forward to talking to you again.
Thanks so much.
To everyone listening, thank you again for joining us. If you enjoyed today's episode, please like, subscribe, and leave us a review. And don't forget, in many jurisdictions in both the US and Canada, nurses, doctors, lawyers, attorneys can earn continuing ed credit just by tuning in. And as always, you can find more resources and past episodes of this podcast at connectmlx.com and on the Inside Medical Malpractice YouTube channel. So tune in next month for part 2 with Jan Marin as we dive into her second article published in the Canadian Lawyer magazine titled How AI is Shaping Medical Malpractice Litigation. You don't want to miss this. So goodbye for now and take good care.